Hola! Today we will talk about Ebola virus, which is a highly lethal pathogen belonging to the Filoviridae family. It causes Ebola virus disease, a severe and frequently fatal hemorrhagic fever in humans. Structurally, it's an enveloped, single-stranded RNA virus. It possesses a distinct filamentous, thread-like shape, often forming 6 or U shapes, coated in surface glycoproteins that it uses to bind to and invade host cells. The incubation period ranges from 2 to 21 days. Once symptoms manifest, the clinical course progresses rapidly. There are 3 phases. The first phase, which is dry phase, from day 1 to 3, sudden onset of non-specific symptoms, high fever, severe headache, myalgia, arthralgia, and profound asthenia. The second phase is wet phase, from day 4 to 7. GIT manifestation takes over. Patients experience severe watery diarrhea, persistent vomiting, and abdominal pain leading to massive fluid and electrolyte loss. The third phase is hemorrhagic or shock phase, from day 7 to 10 plus. There is a vascular leakage peaks manifest at petechiae, ecchymosis, and mucosal bleeding from gums, epistaxis, GIT, and multi-system organ failure, particularly hepatic and renal necrosis, induces hypovolemic shock. Ebola exhibits an average case fatality rate of approximately 50%. Through historical outbreaks have seen mortality rates soar up to 90% depending on the specific viral strain and access to supportive care. There is 2 outcomes. Fatal outcome. This typically occurs between days 6 to 16 due to hypovolemic shock, severe metabolic acidosis, and multi-organ failure. And survivor outcomes. Patients who mount a robust early antibody response, specifically immunoglobulin G against the surface glycoprotein, begin to recover around day 10. However, survivors often experience post-Ebola syndrome, which is characterized by chronic arthralgia, uveitis, severe fatigue, and potential viral resistance in immunological privileged site, which is testis and vitreous humor. Fortunately, the prognosis has improved significantly due to medical advancements. Vaccination. The Ervebo vaccine provide highly effective active immunization against the Zaire strain, and targeted therapeutics. There is monoclonal antibodies like Enmazib and Ibanga directly neutralize the viral glycoprotein, significantly lowering mortality rates if administered early in the course of infection. The outbreak was officially confirmed on May 15, 2026 in the Democratic Republic of the Congo and has since spread to Uganda, who declared it a public health emergency of international concern. The strain outbreak is caused by the Bundibugyo Ebola virus. While it is not a brand new mutation, it's a rare strain that has never caused an epidemic of this scale before. It's now the largest Bundibugyo outbreak on record, with well over 1,000 confirmed cases. This strain is a massive problem because the highly effective vaccines and monoclonal antibodies treatments we use today were engineered specifically for the Zaire strain. They don't work against the Bundibugyo strain. The virus is spreading through remote, densely populated regions heavily destabilized by ongoing armed conflict. This has severely limited humanitarian access, disrupted contact tracing, and allowed the virus to spread undetected for weeks before it was identified. Because the standard medical countermeasures fail against this strain, UCML leaders issued a formal joint leaders call for a coordinated response to the Bundibugyo Ebola outbreak. It included global security threat. UCML leaders warned that the outbreak has not yet peaked and could continue to metastasize for over a year if not aggressively contained, they emphasize the high risk of cross-border transmission. Funding R&D surge. The United States committed hundreds of millions of dollars to the response, and the G7 collectively resolved to fund an immediate emergency R&D pipeline. The goal is to rapidly develop, test, and deliver pondibogyo-specific diagnostics, vaccines, and therapeutics over the coming months. International partners, including Egypt, India, Kenya, and South Korea, to coordinate border surveillance, travel screening guidelines, and resource development to contain the virus within the smallest possible geographical footprint. And finally, we pray to God to protect us and keep illness away from us. Adiós.